but actually telling people to behave a certain way, we know is not particularly effective. What is effective is creating the conditions where those things happen naturally. So creating a team where people trust each other, creating a team where people know that an idea they have will be listened to, creating a culture where people feel and sense that they can be better and that their team can be better.
You're listening to the Medical Protection Podcast Real World Series, where we expose the pain points and explore how we navigate the complexity of healthcare today. My name is Dr Najib Rahman. I'm an emergency medicine consultant in the NHS, as well as a senior medical educator with MPS. We recognise that safety, namely our ability to trust, communicate and create, is vital for enhanced team working and decision-making in the complex world of modern healthcare delivery. However, how do we develop such a high-performing culture? It remains a challenge. In the broadest sense, training is always considered an integral component to improving delivery systems, and simulation is a powerful educational tool to ensure that link between the workplace and the training environment to improve safety and effectiveness of our services. In today's episode, we're going to develop a deeper understanding of the role of simulation training and the challenges and opportunities that exist in utilising this tool in improving psychological safety. Joining me today is Dr Eve Purdy. Eve is an emergency physician and applied anthropologist based out of Gold Coast University Hospital. Having completed fellowships in translational simulation and team performance, Eve has a passion for understanding how we better work together for us and our patients. Really pleased that you're joining us, Eve. Welcome.
Thanks for having me. Pleased to be here.
So, Eve, just to start off, I was reading a bit about your bio, and I hope you're able to share a bit of your journey in healthcare and anthropology and how this relates to your interest in simulation. It sounds really interesting as how we develop ourselves as advocates for medical education and training, even though many of us might not have had those similar opportunities and experiences. So I think there'll be lots to learn and appreciate from how you got to where you are now.
Yeah, sure. I can share a little bit about the journey to where I find myself now. I, like everybody who's going through medical training, found myself as a medical student rotating through hospitals and rotating through different services. And just as you're starting to get comfortable, you move on to a new service and to a new group. And I found that experience both fascinating, but also really hard. And the piece of it that I found hard was not actually the medicine. It was trying to figure out how you belonged in and amongst a new group of people. And so I really was trying to understand this experience for myself. And that's how I got a bit interested in medical education, because I could see this transformation that was happening. But when I took an educator's lens to this, I found that that wasn't quite enough to describe what was happening. So I thought about doing some higher education and a master's of medical education, but I realized that what I was, fundamentally going through and experiencing in all of these places in the hospital was cultural differences. There was a little bit of, content differences between spending time on a cardiology ward versus an emergency department. But fundamentally, there was differences in values, differences in behaviors, differences in the way that people treated each other. And I really wanted to understand more about how organizational culture impacts the way that we do our work in teams, because I felt it so dramatically as a medical student and as an early trainee, bouncing between all of what are just different tribes in the hospital.
So I guess many of us, through training would have experienced some form of simulation, either as participants or facilitators. And, what do you feel the power of simulation really is in that concept that's known as the safe container? I think, we've heard that often when we get, especially as facilitators, when we get trained to run simulation, we talk about simulation being this safe space. Would you mind sharing some understanding about what that means for the audience?
Oh, you bet. Look, I am fortunate enough to have trained as an emergency physician, really as a child of simulation. From day one in my medical training all the way through residency, I was exposed and a participant in simulation. And most of that simulation was directed at making me learn some behaviors and some team leadership behaviors, as well as some medical content. In the simulation that I participated in, I think, went a long way towards achieving those goals, in part because the facilitators who I was lucky enough to be working with and learning from went to great lengths to set up a kind of a safe learning environment. And I guess if we unpack what that looks like participants feeling like they can come into a simulation and take some risks, maybe do something that they've not done before with people who they work with, and really put themselves and some of their vulnerability on show to facilitate learning. And so there's any number of things that simulation facilitators do to create a safe environment. The simplest thing is introductions, giving people clear expectations of what is going to take place during the day, and then relentlessly making efforts to maintain rapport throughout that learning conversation. And again, I was lucky enough to be on the receiving end of really excellent simulation, specifically as it relates to becoming a better doctor. And so I have had a very positive experience with simulation. I know that is not necessarily mirrored by everybody, because if you're not fortunate enough to have been exposed early to facilitators that are paying a lot of attention to creating a safe space and a safe container for learning, there can be some fairly kind of scarring experiences that happen for people. So if you're feeling really judged in a negative way, perhaps it's related to assessment that brings a lot of anxiety. If that is your idea of simulation, then it can set you up a bit problematically moving forward. But I was lucky enough, really, for my 10 years of medical training before I became a consultant, to have been exposed to this as an extremely powerful kind of personal learning tool. And I guess that has served as a bit of a launch point for me, thinking about, if this can be such a powerful personal learning tool, maybe it can be a really powerful social learning tool for our groups. And that's what I spend most of my time thinking about now is, if this can be such a great tool for individuals, how can we capitalize on the potential benefits for larger groups?
Well, that's really interesting. I'm trying to reflect back on some of my own early experiences. Wow, it must be going more than a decade ago now or so. But I remember we went for a simulation training session, and there was kind of three of us as trainees going sequentially into this booth. But in that simulation, we were, as the solo practitioner, there wasn't that many helpers. And I remember one of my colleagues really struggled. They had to leave the sim because they found it so overwhelming.
Mm.
With that intensity, knowing that they were being observed and every decision was being watched. Whereas I think others were, as you said, able to kind of use that safe space. And despite the reassurance of saying, what happens in sim stays in sim, I think from what you're saying, the reality is far more nuanced than that, or if maybe not even nuanced, maybe it's fairly clear that there's stuff that happens before sim, during sim, after sim, that all impacts that experience and the opportunities to be gained.
Yeah, I think you're so right there. So certainly there's a lot that individuals bring into simulation, and that may be some things like their past experiences, perhaps negative or positive with simulation. But really, a lot of it, I think, boils down to the relationships with the people that they have, perhaps as other participants, but especially the facilitators who are responsible for creating this environment. So if I'm a real jerk of a consultant on the floor, I can't expect people to come into a
Yeah.
simulation that I'm facilitating and expect at all that they will feel like they can engage in it in a way that is vulnerable. So really, there's this trust that has to be built and exist. And there's some of that we can actually do in the simulation, but there's a lot of good that can happen before. So if the people that are coming in know that I have a vested interest in them, that I care about them, that I'm interested in them becoming the best clinician that they can, that goes a long ways in making this a positive experience for them. So I think being really attuned to what are your relationships, positive or negative, or is it a non-existent relationship? And this is something that you've got to pay a lot of attention to in that first 10 or 15 minutes that you're with people. I think is probably underdone and under thought about. So as a department, being really considerate about who you're having running these programs. They have to have credibility with learners. They have to have relationships with and I use the term now learners loosely because I think participants is a better word. We're not actually trying to teach professionals
Yeah, yeah.
something. We're creating a space where they can discover and grow together. But the role of the facilitator in that is probably very important.
So that's, I like the way you said if you're a jerk of a consultant on a shop floor. So that requires, I guess, two prerequisites. One is that you have a bit of insight into your strengths and weaknesses as being a jerk or an educator in some ways, both pre-sim and out of sim. But I guess that also leads to the challenge of where, departments are so varied and different sizes. Sometimes sim is delivered just because it's mandated to be delivered, and so you're stuck with who you have. And then other times you've got such a large department where, because of shift patterns, etc., you might not ever even know who's running sim to have that trust and relationship on the shop floor. So, can some of this be mitigated by the facilitator themselves having some, coaching, training, etc., in order how to be a better sim facilitator? And is that kind of almost a bit of a prerequisite to set up a program? So it'd be good to get your thoughts on that as being the ideal facilitator in some ways, given the complexity of the nature of healthcare delivery environments.
Yeah, so I mean, there's no doubt that people bring something into simulation, but we also have this opportunity to shape that experience in the moment. And there are very kind of quite simple, but things that you need to be deliberate about that can really impact and shape people's psychological safety. So things like how you are going to introduce everybody in the room, how you are going to orient people to simulation. Are you going to send out pre-readings in advance? All of these things have the ability to impact simulation. And I think the more opportunity that facilitators have to reflect on that and think about it, the better they will be at sorting out and really fostering psychological safety in that space. So there are lots of opportunities for people to learn about how to do that. Maybe some training of some kind. I think a lot of apprenticeship and seeing other people who do it well is important. But then there's any number of good podcasts, some really core fundamental articles. So Jenny Rudolph's Creating a Safe Container really is a great starting place. I think as soon as somebody is attuned to or aware of the fact that this is something that they want to do, they probably will be on their way to success in making it happen.
Yeah, no, that's some great advice and tips in really kind of investing in one's own personal development to be a better facilitator. So just to kind of clarify in my mind, so we've kind of gone over the idea that simulation is really a quintessential tool for modern medical education. We can't have modern med ed without having simulation involved in some way, shape, or form. And then the other aspect is recognizing that it's not static, it's permeous. There's stuff that happens in and around sim. And in order to kind of capitalize on that, you need great facilitators as well that are invested in this process. Now, my own historical experience of sim, again, as a learner or as a participant, is often people will look at some of the team behaviors and characteristics, etc. But then how do you shift that, to this broader context of culture and psychological safety? Because a lot of what you've described about having a really good sim program is partly linked to culture. And as you said, that's what kind of interferes or influences that sim experience and potentially has the amplification when you leave. So how do you move from, I guess, the traditional model of just exploring team dynamics and team behavior, but actually broadening that scope and, capitalizing on the opportunity of psychological safety?
Yeah, I think this is really kind of the next step for simulation and for departments because in some ways we have limited ourselves by our history. So really, if we look at how simulation started to become embedded in medical education, it largely started in anesthetics, and a lot of the teaching and learning comes from crisis resource management, which is a very specific type of background that focuses purely on some good behaviors that we know lead to good patient outcomes. And those are things like we've all heard thrown around in simulation rooms around the place, like a shared mental model and closed loop communication and role allocation
Which are
and
all really
speaking up.
important, right? They're all really important.
Totally
Yes,
important.
yes.
Yeah, because we know that they lead to good, we know that they lead to good outcomes. So in simulation, we've kind of gone, you need to speak up, you need to role allocate, you need to do these things. But actually telling people to behave a certain way, we know is not particularly effective. What is effective is creating the conditions where those things happen naturally. So creating a team where people trust each other, creating a team where people know that an idea they have will be listened to, creating a culture where people feel and sense that they can be better and that their team can be better. So if we can start to create the cultural conditions that lead to good behaviors, that means that we don't have to train 10,000 people in the behavior. They will just enter the environment or enter the team and automatically participate in those behaviors because the conditions allow for it. And one of the really cool things that we're seeing in simulation is that it is this space where we can actually start to incubate the cultural values that are important for a team. So, for example, if in a specific simulation, I'll give you an example of the simulation that I did today. One of the nurses was responsible for drawing up drugs. And one of the more senior nurses started talking about how they weren't very busy in their role. And so they went to go see if this more junior nurse needed any help. And she started that by saying, look, I didn't want to step on any toes and I wasn't sure really, it's not what I was assigned to. But if you now as a group get to step back and say, no, that type of cross monitoring, that type of helping out is exactly what we want in our department. That is exactly what we value. Then all of a sudden they go back to the floor that day, understanding that, we're not here to be in a competition. We're here to effectively cross monitor and help each other out. Or another example was that same drug nurse said, look, I was drawing up hydrocortisone. And in this situation, I don't really know what it was for. I didn't know why we were giving it. But I looked around the room and I looked at the other drugs that we were drawing up, and I actually just trusted that this was the right thing. And so then we got to have a conversation about trust and what would be the threshold for saying, hey, what's this for? This doesn't seem like the right drug. And we ended up having this discussion between our medical staff and our nursing staff about how we develop and manufacture trust in our team. And I think if we can start to have those types of conversations, that will be really meaningful for our group. Because now all of a sudden, these 10 people who are participating in the simulation go back to the floor a little bit more attuned to how they figure out they're trusting their colleagues or not, which is something that makes healthcare work or not.
Yeah, no, absolutely. Thanks for sharing that story. And I think I'm going to try and pull you up on a couple more stories because I think it'll just help to illustrate some of these concepts and challenges in a bit more detail. And I'm trying to think here of the level of sim that you're involved with, as an expert in that field, and I'm trying to think of maybe what sim looks like in different environments. Going from the standard advanced life support courses or something like that, ranging through to the full kind of participatory in situ shop floor sim, and anything in between. Have you seen negative experiences from participants where there's been stuff that's come into sim because of that cultural dynamic, but that actually the sim has either made things worse or has not added any value, and those same so those same cultural aspects and dynamics have been exported and have remained on the shop floor?
Yes, is the short answer to that. A slightly longer answer to that, that I think won't out any particular kind of group that I've worked with, is something that is a common problem that we see in simulation, which is simulation really being designed for kind of the medical people that are in the room. So even if it's called interprofessional, in air quotes, the objectives clearly are designed to get at medical decision making or medical clinical reasoning. And the nurses are there just acting as props for the physician participants, and really not having authentic challenges. And that has the potential to be so problematic because it sends a strong value signal. The design of the simulation sends a value signal to your group that, yeah, well, the nurses are actually just here for the doctors.
Yeah, go make the
Which,
phone call and call the specialist, please, kind of thing. And that's the role that's been designed for the nurse or something like that.
yeah,
Yeah,
exactly.
yeah,
Or, you're asking them to drop drugs, but you haven't actually created that task for them.
yeah,
And so I've seen that early in COVID, had seen at a couple of hospitals. Obviously, there's any number of really excellent examples of simulation in COVID. But I saw certainly a number of problematic examples where it potentially ramped up anxiety, and got people into a more problematic place than maybe they had started out. So I do think that the kind of diagnostic aspect of a group before you decide this is something that's right is very important. So some teams actually just don't have enough psychological safety, trust, relationships with each other to come into a room and be challenged. Uh,
yeah, yeah.
and that's okay. Actually, there's other ways to think about how to help teams like that. But the opportunity that exists if you can take a team that's maybe on the cusp and bring them into a place and face them with some authentic challenges, and talk about it, really has the opportunity to help them grow. But there certainly is risk. And I think just like simulation can be this place to incubate really good team culture and values, in the hands of the wrong facilitator, in the hands of the wrong objectives. It can also really incubate and amplify problematic things. So it is a bit risky.
So this has got me thinking a little bit. And I know just before we caught up on the podcast, I was saying that I've been lucky enough to participate in some of kind of humanitarian response settings and stuff like that. And one of the things that we focus a lot on is team dynamics. And you have a pre-brief together for maybe weeks, you train together before you deploy, you deploy together, you live together for a time, and you debrief afterwards. And definitely the successful trips have been when the teams have really worked and they trust each other implicitly. And then, going back to your experiences and your research and things, does this mean we need to kind of think differently about SIM and the opportunity it represents? So is there SIM for different purposes? You started saying SIM traditionally came for this crew resource management, technical skill set. But do we need to start thinking of, SIM designed for psychological safety enhancement, and almost maybe a way to almost pre-assess team dynamics and psychological safety and use SIM to explore and unpick some of the challenges? And is that where you think the next stage is going to be for some of this stuff?
I think that we really have underdone simulation as an exploration tool. So I think right now people think of simulation as an intervention for teams, meaning, we want these people to learn this thing, or we want the cath lab to get better at doing caths. So we're going to create some sims for that to happen. And it fits nicely with our medical intervention logic. But I think the anthropologist in me sees simulation as this really powerful time to actually just understand what is going on, and what is happening here. And so I think if we can go into it with a mindset of just understanding what is even happening in teams, that can be a really powerful tool. If the side effect of that is that we are potentially positively impacting their culture. And I don't like the positive negative, but we are shaping their culture in some way, whether we want to or not. I think that will happen. But I guess always being aware of, is this a diagnosis and exploration tool, or is this an intervention tool? And I would say powerfully, it's most powerful in its exploration of teams, and even just allowing them to explore together, because we do a lot of teamwork, but we don't think much about it.
Yeah, no, absolutely. And I guess then by extension, one of the questions would be is that approach universal? Will this work in a range of countries, languages, settings? Or do you need to have almost kind of a preset, health culture already in order to be able to embrace this?
Yeah, I think there's a little bit of data about some cultural differences in simulation, particularly around debriefing in different cultural groups. My guess, though, is that there's a bigger difference, from one organization to the next, or within our hospital, one department to the next, than there would be from one country to the next. I think teams that are willing to engage in, the highest performing teams would be willing to engage in this, because it's all about understanding who we are and figuring out how to get better. And so I think that sense of continuous improvement that exists in high performing teams would be a fairly universal quality. But it doesn't mean that that every team is ready. But I'm not sure that would be as much a geographic cultural difference as it would be an organizational cultural difference.
Yeah, no, okay, that makes sense. That makes real good sense. Super. Eve, thank you so much for that whistle-top tour through the role of SIM and psychological safety. It's definitely something I don't think I appreciated to the same degree, that, how valuable simulation can be to strengthening our teams and really trying to hit those higher peaks of performance, ultimately to prevent patient harm. So thank you for that.
Yeah. And I guess the only thing that I would add in addition would be that being attuned to this in the world of simulation has dramatically spilled into my clinical work, in the way that I approach my teams on a daily basis, in the way that I tried to lead my teams on a daily basis, from simple things like how we introduce each other in the morning, to identifying goals to improve, to debriefing at the end of the shift. Being attuned to how just fundamentally important this is to humans as they learn and grow and try to get better. I think if we're paying attention to it in simulation, then we should probably be paying attention to it in the real world, and the real magnifying glass that simulation has provided our community for understanding how important this is, I think is just a real gift, and something that we should all jump on the opportunity to improve in our clinical work as well.
Yeah, no, absolutely. What happens in SIM does not have to stay in SIM.
Yeah, nor should it.
Great. So I think just to finish off, I don't know if there's something from your own career journey or places you've been that, you look back fondly now and say, that was a critical moment, and you recognize that. And I wonder if there's something you were able to share from that journey.
Oh yeah, I guess there'd be two things that I guess serve as some further reading for everybody as well. One would be, if you've not watched the talk, Timing Tribes and STEMIs by Victoria Brazel, that's available online. That really was a moment when I decided that I wanted to study anthropology and understand how culture impacts the way that we do our work in the hospital. That was a total turning point. And then the second, if you're looking for a good audiobook or an easy read about all this type of work, is The Culture Code by Daniel Coyle. And it's a really accessible read that allows you to understand just how important culture is in getting our teams to perform at their best. So either of those were transformative for me, and I hope would be for your listeners too.
Super. Eve, thanks so much for your time today.
Thanks for having me.
And that brings us to the end of today's episode, Leaky by Nature, Leaky by Design. What I really enjoyed was reflecting on the pivotal role of simulation as a building block of improving and strengthening organizational culture around psychological safety. We'll have an opportunity to delve into this a bit further when speaking to Simon James in our next episode, who is the CEO of Kim's Hospital. If you're a member of Medical Protection, please join us for the upcoming virtual workshop, Beating Burnout. This is a great opportunity to further explore today's topic with your peers during a live and interactive event. Register using the link provided in the podcast description. Medical Protection will be releasing many more podcasts through 2023. So to make listening in the future easier, do subscribe to the channel and listen to podcasts while you go about your day. I've been your host, Dr. Najib Rahman. Goodbye for now.